We had a lot of sort of I suppose not developments in terms of what's actually going to change, but what calls for what could change over the weekend. First of all, in terms of the issue of isolation, we know the Chancellor and the Education Secretary are both now saying that isolation, where you've had two negative tests in a row from lateral flows, should now move down. We've got originally from 10 down to 7 to 5 days. Would you support that?
I don't really know the data, apart from what I've been told and seen on the radio and television myself. But if you're not likely to be infected at 5 days with a negative lateral flow test, or that makes a degree of sense. And America, I think, has gone that way already. So I presume the scientists in America have advised that that's safe.
Although
So,
America's isolation period starts the moment you test positive, as opposed
yeah,
to when you get your symptoms, which is usually, let's face it, a couple of days
a
before.
couple of days, yeah. So there are some issues. Also, I don't think, the availability of lateral flow tests and therefore the speed of getting a diagnosis is much faster in this country on average than many other countries. So there are intricacies to this, which I just don't have the data to give a good answer. It all comes down to how infected you are at 5 days with a negative test, how likely you are to infect another person.
Yeah, and that's the crucial thing. Yes, certainly getting in my cab this morning, coughing away, and having to assure my driver, no, I'm COVID infection free. I just still have the symptoms of it, but I'm not actually a risk to anybody. We've had a call from Dr. Clive Dix. He's the former chief of the vaccine taskforce, for an end to in the next few months to mass testing and ending to mass jabs, focusing on people who get the disease who need clinical help, as opposed to vast number of people getting infected. As there was some 100,000 key workers as of today are going to get those lateral flow tests daily, but there has been a lot of talk about whether or not the government is going to end free lateral flow tests. These aren't free, of course. They do cost money, and every time the government spends money on a lateral flow test for someone healthy to discover they're healthy, that's money that's not spent on cancer care or helping kids catch up with their education, or indeed finding new resources to deal with people who are getting ill with COVID. Do you think that, whether it's sooner or later, we need to end the mass testing of millions of people daily?
Well, what Clive Dix said has always been the aim, to eventually have a situation where you do what we do with flu. The average person doesn't do a flu test when they think they've got flu. They just spend a couple of days at home, or they go around just feeling a bit miserable for a while, and nobody worries too much about it. And the flu that spills over to people who makes them ill, we pick up in the hospital and sort out there. And essentially, that's what we want to aim for with COVID. The problem has been is that the vaccines, although very good, have not been as good as we'd like, in that the efficacy against preventing even hospitalization does seem to wane. And therefore, the population at risk, even in the vaccinated population, is not insignificant. And so when you get big waves of infection, you can have big waves of people ending up in hospital. And that's also the consideration of the 5 million people who have not been vaccinated, which clearly is a big issue, because they can get very sick and end up in hospital and take an ITU bed for 2 weeks, which is $2,500 a day, is a lot of money and blocks a lot of other NHS work that could happen and use that ITU bed.
Yeah, but there are lots of things that people do which could mean they end up in hospital, aren't there? We heard from a hospital consultant at King's College, an ICU consultant, Dr. Steve James, and he met with Sajid Javid, the Health Secretary, on around, and he talked to him about him not being vaccinated but facing the sack in April, even though he's worked on a COVID ward, a COVID ICU ward the entire way through the pandemic. He's had COVID. 10% of staff at that particular hospital are likely to be sacked when it comes to April, because they're not vaccinated. His point was, well, but I've had COVID. I've clearly got antibodies. I've managed to work throughout and he said he had it at some point, but again, he's obviously had symptomless because he was never tested positive for it. But he's got the antibodies. We worry about people who are not vaccinated. If a lot of those people who are not vaccinated are people who've actually been out and about and been working, often in frontline jobs, who've had COVID already, should we be so worried about those people?
Yeah, so the problem with the unvaccinated, you're right. Once they've had COVID, then that risk of them ending up in hospital and intensive care is probably markedly lower than it would be otherwise. So if they've all had COVID infection, then there's much less of an issue. But they haven't.
Yeah.
I mean, there's a significant proportion who've not yet had COVID. They will catch COVID at some point, most likely, especially with Omicron, because it's highly infective. And it's going to come around again as well. This Omicron wave we're having in winter will probably be followed by another one, and we don't know when, but later in this year. So yes, as time goes by, the unvaccinated will acquire natural immunity and be less of an issue. But that period of time by which they have to acquire a natural immunity is not going to be a few months. It's going to be a year, 2 years, 3 years before a significant high portion of them have natural immunity and become less of a burden on the NHS if they catch COVID.
Okay. Can I also ask you about pregnant women? There's a campaign starting today to encourage women who are pregnant to get the COVID vaccine. Look, I mean, I remember when I was pregnant. I mean, we even with terrible morning sickness, told nothing other than paracetamol. You can absolutely understand why women are very, very wary of having any medical treatment, any vaccinations while they are pregnant. But the evidence was really, really clear. It took quite a while for the JCVI to give the advice because you wanted to, weigh up all the evidence around the world that, the vast majority, is it more than 9 out of 10 pregnant women who end up in ICU, they are unvaccinated. There is no doubt at all that pregnant women are specifically at risk from COVID and that they should get the vaccine. Can you explain why?
Yes. When you're pregnant, there are two issues there which make you more susceptible to COVID. First of all, pregnancy is a relative immunosuppression situation. So your immune system is a bit weaker and therefore you're more likely to get severe infection. And secondly, because of the baby growing inside the abdomen, your breathing is actually poorer. The physiology is weaker and therefore it takes less effect in the lung to cause severe problems with your breathing. And yes, if you catch COVID and you're unvaccinated and you're pregnant, especially in the last trimester, then it's a big risk. 40 people have died, 40 pregnant women have died. And there's a 20% chance of a premature birth occurring if you catch COVID in that last trimester. So there's big issues both for the mother and for the baby.
Yeah.
Whereas we've gone through thousands and thousands of pregnancies and there's no evidence of any danger to the fetus at all from the vaccination.
Yeah, absolutely. It's really important to get that message across, isn't it? Can I also ask you about the situation with Novak Djokovic? Obviously, you're not in charge of what happens in Australia, but big row over the fact that he's very much not just anti-COVID vaccine, he's anti-vax. So he's never said whether he is jabbed or not. But the big row there about whether or not he was a risk coming into the country being unjabbed. He's now he's won his court case. He's going to be able to compete in the Australian Open. Is somebody like Novak Djokovic, he claims he was positive in mid-December, despite lots of photographs of him in the following week with lots of people. Doesn't suggest to me he was in isolation if he was positive. But he's not double jabbed. But he hasn't got COVID. He's tested negative to get into the country. Is he a risk to anyone?
He's not a risk, but the symbol of somebody unvaccinated doing what they want with and seemingly flouting the rules is not a good thing. It's a bad example to be set. And he's the author of his own misfortune by not having the vaccine in the first place. And he's in a profession where he will be flying around the world and going across all sorts of different immigration barriers to get into different countries all the time. So not being vaccinated is as an admin hurdle for him, the administrative hurdle is huge, I'd have thought.
But again, people shouldn't. I mean, I know lots of people, for instance, who've got their children vaccinated, who had no intention of their children being vaccinated, already had COVID in this country, but just so they can travel. Now, should people be being forced to give medical treatment to themselves or their children simply because of an admin hurdle and restrictions in other countries getting out of the country or having to isolate when you come here, rather than because they feel they're actually going to be protecting their child or protecting themselves?
Yeah, I mean, this is straying into this issue about personal and public responsibilities. And there is a personal responsibility and a personal choice involved with vaccination. But actually, there's a huge public responsibility. I mean, the problem we have going forward is the unvaccinated population will make another wave of Omicron a problem for the NHS. And that is a problem for the whole of the British public and the UK. And it is not purely an individual choice from that perspective. There is a consequence for making a choice not to be vaccinated for everybody else as well.
And that's because of the impact people have put on the NHS?
Well, I mean, I think that's that's the issue going forward, is these surges of infection where you will end up with more people in hospital with COVID, and the additional pressure that puts on the limited resource we have with the health service. It seems that in the vaccinated, there will still be deaths, but the rate of death is much, much lower than it would be. That's the vaccines working. In the unvaccinated, if it's the same as it was before, yeah, they still have a high.
But if we're talking about pressure on the NHS, then we really need to have a long conversation about obesity, don't we? We know a huge number of people who are a burden on the NHS are because of heart disease, from diabetes. We know instances of cancer and the like. I mean, if we're going to start telling people they need to get a public duty to get vaccinated to save pressure on the NHS, then that we're going to have to talk to people about public duties to live a healthier lifestyle, aren't we?
Well, that's it.
Slippery slope.
It is a slippery slope in some ways, but of course the vaccines can be given in the space of 5 minutes and costs about 50 quid or a bit less than that. It's very simple and very quick and easy. Solving the obesity crisis requires a very much, a joined up strategic thinking, which we're not seeing about how to address that. And that's a much more complicated problem.
Professor Jeremy Brown, really, really good to talk to you.